Hello, everybody. You're welcome to a special episode today. I'm your host, Favor, and today we're going to be talking about one of the most ambitious healthcare initiatives currently being developed for Africa. Imagine a future where every family have access to health education, healthcare guidance, digital health tools, and an opportunity to contribute to medical innovation. Joining me today on the show is no other but Dr. Clement. He's a medical doctor and also a leader, one of our leaders in the family Doctor Africa. So you're welcome to the show, Dr. Clement.
Thank you so much,
Yeah.
Favor.
Can you
How are
introduce-
you?
I'm fine.
See you guys again.
Work has been, it's fine. You're welcome to the show today.
Thank you so much.
Yeah. So before we continue, I want you to introduce yourself to our audience.
Okay, thank you, Favor. My name is Dr. Clement, as you rightly said. I'm a medical doctor, resident in Lagos. I've worked in both public and private sector.
Wow.
Currently, I'm with the family doctor initiative.
Okay.
The reason is that want to take up new challenge. And taking up new challenge, you need to unseat yourself from your previous comfort zone. So yeah, and I hope that we're able to give Africa a lot as far as healthcare innovation is concerned. So thank you for having me, Favor.
You're welcome. So I want to know, why did you become a doctor?
Interesting. So I noticed that way back when I was very little, I've always had this penchant for caring for people, and I don't know if you know, my name Clement actually means to sort of show mercy, sort of to empathize. Yes, that's actually the meaning of the name. So I think that name follows me. It has been following me actually. So I had a scenario that happened when I was very little. I think about 5, 6 years. I can see replay that scenario in my head. We had a little puppy in the house back then, and I was so fond of this puppy. And then one day the puppy came back from wherever it went to, and then it usually plays with me and all of that. And then I noticed that the puppy was always in its cage throughout the day. And then it was dinner time, and then I was looking for the puppy. I went to drop food where the puppy usually eats. And after a while, I saw that the puppy was not there. So I had to check, and I noticed that the puppy was in the cage. When I checked, it had an injury, actually a broken leg, probably where she went playing. So I now took the puppy as small as I was. It was actually because of me, they actually bought that puppy. So I took the photo to my mom, like, only this puppy, what's happening? She was like, what happened now? Like the leg. She now like, that she wants to take it to the veterinary doctor. So I quickly got the clothes and then wrapped the leg.
Assisted the puppy.
Yeah. And then I followed my mommy to the veterinary doctor, you know. And from there, I just grew up with that notion that, yes, we need to help people. That's one. And then second, I'm very inquisitive. I always try to find out why certain things happen the way they are. I am amazed by the ingenuity of human creation, right? I always want to find out why are human beings made the way they are. And I noticed that it is only medicine that can give me a leap into that idea, into finding out why we are created the way we are. And these are some of the things that contributed to my desire into studying medicine. And I eventually went to medical school after having the first degree. Went to medical school, graduated, and voila, here I am. The rest, they say, is history. And I'm glad I couldn't have asked for a better profession than this.
Yeah, you wouldn't have been on the show. Yeah. So, was there a specific moment when you realized that the healthcare in Africa needed a different approach?
Yes, that from medical school. Because I don't know if you know, for you to become a doctor, you would, in Nigeria, and to be precise, you would have spent at least 7 years. Out of those 7 years, about 4 to 5 of those years you spend in the clinical settings. So the clinical settings mean you'll be in the teaching hospital with your consultant, your senior registrars, other registrars, and then patients generally. So you'll be exposed to patients of different illnesses coming in every day, seeking for health attention and all of that. So if you have been in that space for that long, my graduation experience, I will not be far from the fact if I tell you that healthcare in Africa needs a different approach to what we have currently. And I have also, I travel a lot by virtue of my certain positions I've held in the past while in medical school and all of that. I travel a lot. I've gone to lots of African countries and beyond. I can tell you for a fact that what you have in Nigeria is what you have across most African countries. In fact, in some other African countries, it's even worse than what we have here in Nigeria. Just a few African countries that will say that yes, the healthcare system it's considerably okay, but lots of others are not living up to standard, up to par with what we have in other clients like the Western world. So I've always believed that healthcare in Africa needs to have a different approach. We don't have adequate health education. We are not self-aware of our health status, unlike what we have in other climes. What I mean by other climes, developed climes, the UK, the US, and other Western world. Patients presenting in African hospitals, most of them at a very late presentation. And this cut across all classes of the society, all strata of the society, be you rich, poor, or middle income earner. You discover that we have very poor health-seeking behavior, and that is why we tend to present in the hospital at a very late stage. And at that point, there's little or nothing the doctor can do in the hospital. That's one. There's also other aspect that you can say contribute to this, maybe the cause and all of that. But then there's something that is inherent in our society as a people that we tend not to give our health the adequate attention it requires, right? And I believe that needs to change. We need to have that paradigm shift from we coming to the hospital when we are sick. As a matter of fact, yes, health doesn't necessarily start from the hospital. As a matter of fact, health starts from us being at home and in our community. It is when you are sick that you should be in the hospital. But health is not necessarily the absence of sickness as defined by WHO. You know, it is the complete state of you being in a complete social, mental, economical, and other aspects, not necessarily the absence of disease. So the hospital itself, as it were designed, is for people that are sick. But there's a preventive aspect of medicine. There's a curative aspect of medicine. There are other aspects of medicine. We tend to focus in our clients only on the curative. We fail to understand that the preventive aspect of medicine ultimately determines what the curative do. In fact, the preventive aspect actually determines the outcome of the curative. So if you are aware, you are self-aware of your health status, you know that, okay, when you have certain things, this is a warning sign. When you have certain things, it shouldn't be. Are you also aware that, I must not necessarily have to be sick before I go to the hospital? If all of these are being taken into consideration, our health system in Africa will be a lot better for it. So yes, I agree that what we have currently is not the best. We are not even close to the best. We need to have a mind shift from what we currently have so that we can ultimately build a better and healthier African for everyone. I'm a Pan-Africanist, and I believe that there's a lot we can achieve, not just in the health sector and the other aspect of our society as far as the continent is concerned.
That means the healthcare in Africa still needs to go under development.
Absolutely.
So what exactly is the family doctor?
Okay, so the Family Doctor Africa is a platform that was created out of the need for us to build capacity across our human population in Africa. We understood that the African continent is lagging behind As a matter of fact, the health system in Africa is appalling to say the least. It's appalling, and for that we understand that there is need for us to build capacity, and that is why um, the Family Doctor Africa initiative is timely, and is at this point in time something that everyone needs to be on board and then participate actively. Yeah, the program was designed specifically to build capacity across African homes, to make sure that every African home has a family doctor. By family doctor, I'm not saying that we want to train medical doctors to be in those homes.
I was about to ask.
Yes. We don't mean we're going to train medical doctors to be in those homes. But what we mean is that we need to build capacity across these homes so that we can have some sort of people that are health oriented, health conscious, people like the first responders that we have in other clients. If you go, for instance, the UK or the US, for instance, and maybe you are in a pitch playing, or you went to like a recreational center or a park, for instance, you are playing, and suddenly somebody collapsed, right? Before the paramedics get to that person, with the intent of course, transporting that person or stabilizes that person before taking that person to the hospital, the passers-by, these bystanders would have intervened before the paramedics get there. Do you know why they can intervene? They can intervene because they have the requisite knowledge. They know what they can do in the interim before the trained paramedics gets there and ultimately stabilizing the person before taking the person to the hospital. But that, you can't say the same.
There was no.
Exactly. You can't say the same in Africa or Nigeria in particular. Why? Because people don't know. If somebody collapses, or in fact, people that are around it doesn't even know the state of that person. They don't even know if this person that has collapsed, the person just fainted, or we call syncope in medicine, or the person has cardiac arrest or heart attack, what they call in the general palace, right? So understanding this gap in the healthcare system, that is why we at the Family Doctor Africa thought to bring this sort of initiative to Africa to groom and train every member of our community to make sure that you'll be able to intervene in an emergency situation, either in your homes or in your communities, in your churches, in your market, or anywhere you find yourself, so that you can contribute to rehabilitate, or rather stabilizing or helping that patient before the needed trained personnel come to attend to that patient. So that is essentially what we aim at achieving in this initiative. And it's our honest and our desire that every member that participates in this program will have value for the resources he or she has invested into the program, and then the society will be better for it, the community will be better for it, and ultimately Africa as a whole will be better for it in terms of healthcare.
Okay. So let's talk about the community tier. Who is it designed for?
Okay, so we have like different tiers of this program. We have the community tiers and then other tiers that we'll look at because of our discussion here. So the community tiers is designed for the communities. It's designed for every member of the community.
Everybody.
Students in the community, mothers in the community, healthcare professionals in the community, accountants. You can name it.
Anybody can be.
Anybody that is in the community can be part of it. The idea is that we want to equip each and every one of us with the necessary knowledge to make sure that we are able to respond in an emergency situation at the community level. This we have understood will greatly improve our health status. Africa happens to have one of the lowest standard of living, quality of life, and even lifespan ranges across the world. So the reason is more far-fetched. It is because of our healthcare system. Your healthcare system is directly proportional to your lifespan. If you have an improved quality healthcare system, you have people living longer. That's why you go to places like Europe, for instance, Italy. You have people that are very old. You know why? Because they have a very well sophisticated healthcare system that cater for every
Individual.
individual, irrespective of their age, irrespective of their economic status, or irrespective of their societal status. It doesn't discriminate. In Nigeria or in Africa, you can only access quality healthcare if you're rich.
Yes.
A lot of people pay out of pocket. A lot of people are living below the poverty line. They are living below $1 a day. Tell me how. See, you are just one diagnosis away from being poor. It's just one diagnosis that can take your entire seasons.
Everything you work.
In fact, some don't even have what they work for because they've not worked for anything because the economy has been so bad that they are barely living from hand to mouth, as they call it. So you are just one diagnosis away from. So as a doctor in Nigeria, I am telling you that your honest prayer should always be that you should not be sick. You should not be sick because you are just one diagnosis away from putting your information on the social media for people to come and crowd fund or good fund you to contribute just so that you can live. But that is not what is tenable in other clients, right? So understanding that, yes, we don't have the economic wherewithal to be able to salvage yourself when you are confronted with a health problem, it is important, way beneficial for you to understand the preventive measures, what you should look out for before even the illness comes. So that is why this program is designed. And it is my desire that as we progress in this initiative, in this program, we're going to have lots of African homes subscribing into the program. Then having family doctor. It doesn't matter how many family doctors you have in your home.
Everybody can be a family doctor.
You cannot have enough. So yes, that is what the community care is all about.
Okay. So what does someone stand to get? What did they receive when they join this community here?
Okay, so the community here has a lot in store for people. One and very important is the family doctor health passport.
Okay.
This health passport is like it's an e-passport. Look at it this way. If you've been to Nigerian hospital before, the what we call this, we have a disjointed kind of health medical record, right? Where if you are in Lagos, for instance, you're sick and you are traveling to Abuja, or maybe you are traveling to somewhere and then you probably stop in Abuja and then something happened. They cannot quickly in Abuja bring out your record, your health record in Lagos, right? And this comes across most African countries, right? And assuming you are in an emergency situation and you are even incapacitated, for instance, you probably went into shock, you are unconscious, or you fainted, or you have cardiac arrest, or something that you are able to tell the doctor or someone who's attending to you what your health status is. The doctor at best will have to probably run some preliminary tests to get some of this information before he can even proceed to taking care exactly attending to you. But imagine you have a system, right? An e-system that by just putting your name or your number on a system, which will just run through your basic health information. For instance, your blood group, your certain health status, right? If you have any existing health condition, it can just point out, right? That will greatly improve the care of that patient. It will also greatly improve the time of intervention exactly for that patient, and it will ultimately result in the overall improved health care delivery to that person. That is one of the most important things that subscribers tend or have to gain from subscribing into the community tier. That initiative is such that it's going to cut across all Africa. Our platform is globalized, right? And it's our honest desire that as we start in Africa, we're going to even go beyond Africa. So that should you want to travel, for instance, say you are going for vacation, because I'm always of the opinion that yes, Africa is home, it's sweet, but you do probably want to explore other continents, right? And you're there, and then there's a need for health intervention, right? They don't need to don't know what is wrong with you, right? You by that chip that you, or rather the passport you will have. I don't know if you noticed, like in some developed countries, they have like a ban that is that's wrapped, yes, one around the list of certain people with diabetes or hypertension, for instance. Exactly, you know that okay, this person is exactly similar thing we intend to achieve here, right? But the good thing about this one is that once that you are seen, they can easily run through your information on our platform, and they'll get the basic information about you, your basic health status, and then they'll know what to do for you. That is one amongst several other things that the subscriber tend to gain. Subscriber will gain consultation from our medical doctors when they have need. They're going to have opportunity to contribute into health innovation. They're going to also have opportunity to contribute into research, right? They also going to have opportunity to be trained, get health information. They're going to also be trained as first responder, and depending on the status of the individual joining the program. So at every level, for instance, if you're a medical doctor, you want to join the community program, you have a program designed for you. If you're a market woman and want to join the program, or have a program, want to join the Family Doctor Africa program, you have the program designed for you. So every um, um, person in the society is well captured, irrespective of your status, your academic qualification, or your professional development. Just know that there's something for each and everyone. Yes.
So many people listening would want to know how they can join this.
Okay, so
What they need to do.
Okay, so
And
joining our program is simple. You can just join our program through our website, the Family Doctor Africa website. From the website, you can navigate into downloading even this app that I talked about, the passport. There's the Doctor Passport app. You register. It's a very simple website. The steps are very simple. You can easily join, navigate from there, register, and then you download the app, and voila, you'll be able to have access to all of these things that I've mentioned and I've even beyond that.
Okay. You keep mentioning community. So why is that such an important part of this vision?
Because we believe that Africa is a communal state. Yes, you cannot have the kind of society we have in Africa elsewhere in the world. I have friends who are in Europe and UK. When we were growing up, say, well, let me ask you, in your compound that you are grew up with, maybe when you were small, you agree with me that when you guys were little, and when one uncle in the compound sees a small baby or a small boy or girl doing something wrong, that uncle can scold that child without necessarily having to take permission from the parents of that child, right? That is the spirit of the community we have in Africa, right? Africa lives as a community, not as an individual. Everybody look out for each other. So the community tier initiative is designed in that light so that you guys can be collaborators, right? You will look out for each other. People that have similar health conditions can come together and share ideas, share encouragement, right? Because when you know that you have people that have similar issues that you have, you'll be free, and it will be easier for you to communicate your conditions with them rather than doing that with somebody who is not in that state.
So they won't understand.
Exactly. That is why we've designed this community tier so that people can have that sense of belonging that, yes, the community is their own. They are part and parcel of the community. They are not going to be judged based on what they have or what they don't have, right? And it will provide that platform for them to adequately benefit from all the fantastic programs and initiatives that we have designed for this program. So that is what the community tier aim to achieve. And it is our honest desire that we're going to achieve that and even beyond.
Okay, so can anybody contribute maybe an idea or a knowledge in this community?
Certainly. everybody can contribute. Your contribution is going to be, of course, backed by, I don't know, I may mention about we having other professionals that are going to join our program. Also have doctors, in-house doctors in our program. Once you join the community tier, right, depending on which is your interest, for instance, if you have an interest to have health knowledge to become, say, for instance, a first responder, we have a program that has been designed for 8 weeks to train those set of people, right, to become first responders. If you just want to be an innovator who has interest in research, maybe you are a student or you are a professional, you are a lecturer in a university, you are a researcher with research institutes, and you want to contribute to that research pool, we also have a program that is designed for that, right? So every member of that community has a stake and has a role to play. And that role includes making contribution, making research, gaining knowledge, and also contributing to the overall improvement of the community. Yeah.
So what if someone wants to join, maybe more than the community?
Backed drug innovation fellowship. Yeah, this is another program that has been designed for particularly people with interest in research, and this research will be centered on African remedies that have been documented over the years, right? These remedies are such that they are going to go through a thorough scientific research that can be reproducible, that can go through very tight scrutiny, such that it will also pass a regulatory test. You can agree with me that yes, over the years, we know that yes, there are, for instance, certain meals that are consumed in Africa that are good for certain diseases. And there are certain meals that you shouldn't be eating when you have certain diseases. These are some of the things we intend to achieve in the fellowship. We intend to build and gather data such that this data will help us streamline with scientific evidence these remedies, some of the foods that we consume, and how they can help to solve or to contribute to the healthcare of a particular disease entity. This is such that people with health condition will have an empirical, well-documented, research-based data that they can reference, that they can refer to, not necessarily during if you would agree with me that if you don't go out to the street of Lagos now, you see people carrying all sorts of herbs. Our people have been taking that for so long. They don't have any scientific basis. They do not have any scientific backing. But with this innovation, we'll be able to make sure that all of these are well documented, well researched, and have gone through all the phases of trials before we can recommend such to our community to consume.
So, Dr. Clement,
Yep.
I heard that participants can also conduct research.
Yes.
So, can you tell us more about that?
Okay, so yeah, in fact, both the community and even the fellowship, yes, participants can conduct research. The research for the community here, for instance, is geared towards having well-detailed, evidence-based scientific database for African remedies that we've had that are currently being used. In fact, I wouldn't say suffered in the past. Because yes, you can agree with me that I go to our homes, there are lots of things to take there, bitter leaf, neem tree, a lot of them. We've been taking those things over the years without any scientific basis. So what we want to do now is to, come local, add some sort of science to it, look at those things empirically and see what are the active ingredients in some of these things we take and see how we can extract this active ingredient and then convert them into some sort of capsule or tablet that can be used, So this is going to be evidence-based, science, research-backed. It's going to go through all the phases of clinical trial, and it's going to be backed by regulatory authorities in Nigeria and other African countries, as the case may be. It is going to follow the US standard of food and drug regulatory protocol. That is what we want to achieve. And the same thing is what is even applicable in most African countries. So that is what we intend to achieve. So yes, both the participants will be allowed to go into research. They are also going to have like a research fellowship that will also be dedicated solely for research. This research will have researchers, academicians from across diverse fields, yes, biochemistry, pharmacists, medical doctors, public health physicians, and a host of others that will come together to see how we can collectively, come up with this research that can stand the test of time, that can be reproducible anywhere in the world, and that we can defend with our futures that yes, this came from our initiatives, and now we are proud to be part and parcel of that creation.
Of that creation.
Yeah.
Okay. So what about people that want to build career from the Family Doctor Africa?
Yes. That's a good one. The Family Doctor Africa also has, as a matter of fact, I'll tell you that this is one of the, if not the only, healthcare innovation across Africa that is all-encompassing. And from what I've said so far, there's an aspect where we take care of patients. There's an aspect where you get knowledge. There's an aspect where we empower patients to also to take charge of their health. There's an aspect where we do research. There's an aspect of career progression now, right? So the career progression in if you join our team, there's also an aspect where we can train people to become community health agents. You can train people to become wellness coaches. You can train people to become nutrition assistant, more like those that have special care. For instance, a patient who is diabetic, right, does not have the same meal routine like somebody who is not diabetic, right? So that is why, as a diabetic, after being managed by an endocrinologist who is a doctor, they are also referred to the dietitian to plan their meal, right? So we are going to be working closely with doctors and dietitians to train these people so that they will be more like nutritionist assistants for cases like diabetics, for instance. These people will be able to, be with this patient, tell them what to eat, what not to eat, as already prescribed by their doctors. I don't know if you get. So we are empowering people to also have some sort of career, on their own. So yeah, these are some of the career pathways that are available for our participants.
Okay. So why is developing healthcare talent so important for Africa?
Because Africa is in a dire need of healthcare professional, right? There are fewer doctors. Let me give you a statistics that you would be amazed. The whole of Nigeria, active practicing doctor, as I'm talking to you, are no more than 60,000.
Wow.
Yes, for a population of over 250 million. WHO standard is that every doctor, right, should be to every doctor should be to a ratio of 1 doctor to 600 patients. But if you do about 60,000 to 250 million, that's
like 1 doctor to 3,000.
Almost about 12,000 patients. If you want to go with that statistics, right? That is not. And to shock you, most of these doctors are living on a daily basis for so many factors. The push factors and the pull factors. Push factors, the environment is not conducive. the healthcare system is bad, the pay is very abysmal, and all of that. The pull factor, there are juicy offers elsewhere in the world. They say, come, we'll give you this, we'll give you this, make your life comfortable. Insecurity, where they are going, there's no insecurity as much. Here, if you're a doctor, you cannot work on the street because they feel like you have money, you don't have money. They'll pick you, and the next thing they'll do confirm you to come and rescue you. So all of this contributes to the dire situation in the healthcare system in Africa, right? And that is why this invitation is timely, it is important, it is at this point in time where, yes, we need every hand to be on deck to ensure that we improve on the healthcare outcome in Africa.
Okay. So how do doctors, student doctors, practitioner nurses, how do they fit into this healthcare ecosystem?
Okay, so there's a lot from what I've been saying. There's a lot that they can contribute to or they can fit into. Doctors, medical students, consultant, professional, pharmacists, nurses, medical lab scientists, name them. All of these categories of healthcare workers have a role to play in this ecosystem. For instance, they can go into the research, right? Research, depending on the area you want to research on, all of these persons can contribute in one way or the other into research. These guys can also gain knowledge because, yes, the knowledge across these healthcare workers, you agree with me, is not the same. The knowledge that a medical doctor has, for instance, is not the same as other healthcare workers. So there is need for knowledge transfer. There is need for collaboration, and there is need for information sharing. And that is where all of these guys fit into the system. So the system is so broad and is so designed that every member of the healthcare system can participate actively in the program. And even those that are not even in the healthcare ecosystem can also be part and parcel of the system. So that is how encompassing the system is. And this is something that I would say that, yes, we are coming for Africa, and by the grace of God and by the collective collaboration of everyone involved, the team and every member of our system here, will be able to give something that will outlive all of us. And that is the initiative, and that is the idea, all of us. Drop something that will outlive, even when they're not here, they're like, yeah, these guys are disappointed that we're able to do this, and they're able to
achieve something. So one of the fascinating things you've talked about is the for the Family Doctor Africa is the AI Drug Discovery Fellowship. So what exactly is this?
Okay, so so you asked about the AI Drug Discovery Fellowship. So this is a fellowship that is designed specifically for researchers and even innovators and even those that have inquisitive minds, right? If you are in your early research career, you can also join the fellowship. The fellowship is designed such that it's going to be AI-backed research, right? AI is taking over the world in every aspect of our...
Everybody can.
Exactly. So what we want to do, we want to utilize the flexibility and the benefit that come with application of AI, not just in health, but also in research. So this research is going to be AI-backed. AI is going to help us in fine-tuning our research. It's going to help us in data collection. It's going to help us in project design. It's also going to help us to streamline what are the immediate health needs of Africa that we need to focus our research on. It's also going to help us identify some of those remedies that have been used over the years in Africa that have not been documented or that have not been well researched. So the research is going to be AI-backed, but yes, researchers across all fields we're going to participate actively in this fellowship. The fellowship we're going to be launching it very soon. Yes, and once we come on board, the participants are going to be selected through a very rigorous process, and then they are going to be launched into the fellowship, and the fellowship is going to last for a couple of months. After which, whatever we are able to formulate or get from the research, they're not going to now subject it to further trials and further clinical criticism and testing before we eventually put it out there for our teeming population for usage.
Okay. I think I've heard you like twice mentioned a particular disease called diabetes. You've referenced. So why focus on diabetes?
Okay, so our focus is not just on diabetes, but yes, diabetes is of concern because the burden is a lot in Africa. The burden of diabetes is a lot in Africa. Diabetes before now used to be seen as a disease of affluence, disease of the West. But you agree with me that gradually the Western culture has creeping into our society. And that is why we're beginning to have the prevalence of that disease in this part of the world. And the disease is such that it can be managed in addition, of course, to medical management. It can also be managed with diet and some other lifestyle modification. And understanding this, we thought that yes, it will provide a solid foundation looking at what we consume here, the kind of food we eat. There's a way we can redesign our mindset, redesign the food we eat that will give us a better outcome for people living with diabetes. Yes. So, and also it has a debilitating consequence. For now, diabetes is not cured, it's not curable. It can only be managed. But the debilitating effect of diabetes goes beyond just the word diabetes. Diabetes can affect the heart, it can affect your kidney, it can affect your brain.
Wow.
Yes. So it can even affect your lungs. When you have diabetes, you have deranged lipid profile. You are at the risk of coming down with what we call MI, or you can throw a PE, pulmonary embolism, for instance, and that is debilitating. So diabetes has a very serious consequences on health, right? And that is why it is among our top interests in this research. Of course, there are other interests that we are also going to work on. But yes, diabetes is there because of some of these things that happen.
So what makes this fellowship, what makes this different from traditional research program? What makes this research program stand out?
Okay. You would agree with me that health innovators or health innovation in Africa have not really taken this dimension before. This is the first of its kind we have in Africa, and I'm proud to be part of the team that is bringing this to our TS to Africa. So the program is such that we have our area of interest. We have things we want to achieve. We spell out our goal explicitly, and it is time bound. We don't just admit people into the fellowship and then allow them 0 and 1 years to be in the fellowship. So the fellowship is designed to achieve a particular purpose. So we're going to have different cohorts, different subgroups in the fellowship. So each subgroup will be focused on identify a particular problem of concern, and then they are going to work towards addressing that problem. Unlike the conventional research that it is not backed by anything, and it is going to be like the conventional research. Most conventional research that you see, the research is aimed at solving a problem of the financier of that research. For instance, there's a big pharmaceutical company somewhere that wants you to do a research. If you're an academician in the university and wants you to do a research, no matter how the outcome of that research must be, the result must be to the benefit of this financier. Yeah, they have. So they say, "He who pays the piper dictates the tone." Yes. So if you are paid as a researcher, you will do the research. The result, the outcome of that result must be in conformity with what the person paying you want. That is not the case in our own. We are throwing our research open. We are not giving any individual researcher a particular aim because we want to achieve. So we are not giving them that, okay, you must, this research must have this outcome, right? It's an open-ended research. Do it, identify it, do it, and tell us what you have come up with, and make sure that whatever it is you've come up with can be reproducible elsewhere, not just the one we do here. So that is why this is quite different from the conventional. Yeah.
So what role will AI play in this?
Okay, so I've mentioned that before, but just by way of emphasis, AI will help us to, one, streamline the research topics, also identify remedies that has always been used in Africa for a long time but has not have any scientific backing, right? AI is also going to help us to aggregate some of this data, and AI is going to also help us to adequately store this data for future references. AI is going to help us to do a lot as far as this research is concerned, and that is why we are using AI as a tool in doing this research. So yes, it's going to be backed by AI, but at the end of the day, people will see that yes, this drug discovery fellowship is quite different from what has been in existence previously.
Okay. So who can participate in this fellowship?
This fellowship is open to everyone: students, doctors, pharmacists, professors, researchers, research assistants, all healthcare professionals. Yes. People with interest in health, people with interest in innovation, people with interest in research, people with interest in seeing to the overall improvement of the health status in Africa, and people that have the Pan-African spirit. They are all welcome, irrespective of your state of or your status or your level of research awareness. If you are a early career researcher, if you are if you are mid-entry career researcher, if you are a professional career researcher, everyone is invited to participate and join this team. And collectively, we can contribute to the overall improvement of the health status in Africa.
Okay. So what are the long impacts? Could it have to this fellowship? What's the long-term impact can this have to this fellowship?
Okay, so the long-term impact is that our aim is to ensure that healthcare in Africa is improved, right? That is our ultimate goal. That's one. The second thing is that we intend to have African homes having access to health without necessarily killing themselves or breaking their backs before they can have access to health. So we want to make sure that we have access to quality health at a very affordable way that every family in Africa can afford. That is not the case today. Health is not supposed to be reserved for the wealthy or the right. Health is supposed to be for all.
Everybody.
Yes, irrespective of their status. I've been in the hospital setting before as a doctor that I have to be paying patients bill out of my pocket. As a doctor, how many patients bill can you pay? Yes. And that is the decadence in the health system, not just in Nigeria, but across all African countries. These are some of the things we want to eliminate moving forward. So long term, we're looking at how Africans can actually get some of these remedies at a very rate that it's comparable anywhere else in the world without necessarily breaking their back. Like, we also have other innovations that we are also going to bring up. In the Family Doctor African program, that people across Africa, government agencies, NGOs will be calling us and they want to participate and then collaborate with us because it's going to be first of its kind, and we are pro-Africa, we are Pan-Africa, and we are in Africa and we are for Africa. Yeah. And at the end of the day, Africa will be happy for having us.
Yeah. So how does the family doctor community, because you made mention that the researcher for professionals in the healthcare system, so how do these people that are part of the family doctor community contribute to the research?
Yes, so the community can contribute in so many ways. They can be research assistants.
Mm.
For those of them that have interest in research, they can also, those that have interest in innovation can also be part and parcel of it. Some of them can also help by giving us, because yes, where we are today, even though we are going to use some of these tools that we've talked about, there's some of them in the community might have knowledge about certain remedies that they've been using that we might not necessarily be aware of. These are some of the ways they can come in. So as a participant in the community, all I would say is that have an open mind. There's a lot you are going to contribute as far as the fellowship is concerned. And I put it to you that have an open mind, subscribe to the fellowship, and then come in. There's something for
Everybody, nobody's left behind.
Nobody will be left.
Yeah. So why is building this community as an important before building products?
Yes, because we understand that by the time we have a community, the community will have trust in the system that they are part and parcel of.
Yeah.
If you have trust in the system that you also contribute, and you know that this system is not some jamboree system, it's not some system that came as a way of some conjuring or somebody somewhere just say, let there be, and it happened. You know that this system came from a basis of well-documented scientific protocol, right? You have trust
Yeah.
in the system. So it is important we build this community so that by the time we eventually launch some of these products, the community will not have any problem.
Yeah, they won't have that.
Don't have any doubt whatsoever in not just utilizing the product, but even selling the product out, right? So, like I said, at the end of the day, right, when this product is launched, this product is going to undergo very tight scrutiny across Africa, right? In fact, we even what the situation where we even sending across Africa. We are actually looking at the regulatory body like FDA of the US to come in, and that is why we say that whatever we're going to have here is going to have scientific basis so that it can be reproduced anywhere else in the world, right? So that is what we aim to achieve, and by His grace, we're going to achieve that.
So where do you see family doctor Africa in next 10 years?
I see us leading Africa in healthcare innovation. I see us becoming a reference point for ministries of health across Africa, for non-governmental organizations like the NCDC, for instance, or Africa Center for Disease Control, for instance, or WHO African Region, for instance, and Peristal's and ministries across Africa health system referencing us, reaching out to us for innovative ideas on how they can improve their health system. That is where I see family Dr. Africa in the next 10 years and beyond. And with the minds we have here, I think it's going to be a walk in the park for us to achieve those things.
Yeah. So, Dr. Clement, what does success mean to you?
Success. So success means a couple of things: personal and professional. Professional success is what I'm going to talk about here. My personal success, if I tell you now, you say I'm too ambitious. Well, I am an ambitious man. I like the fact that I'm actually ambitious. Yes, success professionally for me is when I see every human being, irrespective of your race or your creed or your economic status in the society, you're able to access health, quality health, right, anywhere in the world at a rate that you do not necessarily have to break your back. As a matter of fact, you don't even have to break your pocket in doing that. I've always been of the opinion that as a medical doctor, I'd rather be in a position where I can implement policies, implement policies that will affect the delivery of health care to 5 million people than me attending to one patient at a time. I don't know if you understand what I just meant. Like, as a doctor, however good you are, be a neurosurgeon, be you any type of surgery or any type of doctor that you are, you can only attend to one patient at a time. Have you imagined being a doctor, being in a position where you're going to make policies or innovate ideas that will affect the practice of that medicine across Africa, right? That your one idea or that your one policy is affecting lots of countries, millions of patients at the same time. Which one is more impactful? So that is what I would define as professional success. And that is why I am doing some of these things that I'm doing, to see that, yes, we can position ourselves, in a place that we can make impact that just don't just affect one person, but cut across millions of people across Africa and beyond.
Okay. So if every African listening right now, Dr. Clement, could only remember one thing from today's conversation, what should it be?
Okay, I will say that every African home listening to us right now should know that healthcare transformation will not start from the hospital alone. Healthcare transformation starts from our homes. In fact, it starts from individuals, our homes, our communities, before we escalate it, right? And Family Doctor Africa is that platform where each and every member of our community should subscribe into and participate. And I can tell you for free that the Family Doctor Africa program is not just a program, it's a movement. It's a movement for healthier Africa. It's a movement for a more transformative Africa. It's a movement that will see Africa living where we are at the moment to a position where we want to take our rightful place globally in terms of healthcare innovation and practice.
Yeah. So thank you, Dr. Clement. Thank you for joining us in today's show. So to everyone listening, either you're a researcher, you are a doctor, you are a practitioner, a nurse, even just a regular person, you can be part of this movement. And if you want to learn more, you can visit our website, Family Doctor website. Also, joining this community is paramount. And also, you can also join and learn more by downloading the Healthcare Passport app. Thank you, and see you in another episode.